Which of the following is the main factor in increased blood loss after cardiopulmonary bypass? A. The use of heparin during CPB. B. Activation of platelets and coagulation pathways. C. The release of vasodilators. D. Direct trauma to the chest during surgery. Answer: B. Activation of platelets and coagulation pathways. Explanation: activation of platelets and coagulation pathways during CPB leads to a hypercoagulable state initially, followed by coagulopathy, dilutional or consumptive, increasing the risk of postoperative bleeding. This is often exacerbated by the use of heparin and anticoagulants. What role does preoperative renal function play in the development of acute kidney injury, AKI, following CPB? A. Preoperative renal function has no impact on AKI risk. B. Patients with preoperative renal impairment have a significantly higher risk of AKI. C. Preoperative renal function determines the need for hemodialysis during surgery. D. Preoperative renal function predicts the length of ICU stay after surgery. Answer: B. Patients with preoperative renal impairment have a significantly higher risk of AKI. Explanation: preoperative renal impairment significantly increases the likelihood of acute kidney injury, AKI, after CPB. Poor renal function can compromise the kidney's ability to handle the stress of hypoperfusion and fluid shifts during surgery, leading to worsened outcomes. How does hemodilution during CPB contribute to organ dysfunction? A. By increasing blood viscosity. B. By reducing blood oxygen carrying capacity. C. By causing fluid overload in the lungs. D. By affecting coagulation and platelet function. Answer: D. By affecting coagulation and platelet function. Explanation: hemodilution during CPB lowers the concentration of clotting factors and platelets in the blood, increasing the risk of coagulopathy. It can lead to bleeding complications and impair the body's ability to form protective clots after surgery. What is the impact of deep hypothermic circulatory arrest, DHCA, on the brain during CPB? A. It enhances brain metabolism to prevent ischemia. B. It increases blood flow to the brain, reducing the risk of injury. C. It can contribute to brain ischemia and delayed neurocognitive dysfunction. D. It causes irreversible brain injury due to complete cessation of blood flow. Answer: C. It can contribute to brain ischemia and delayed neurocognitive dysfunction. Explanation: deep hypothermic circulatory arrest, DHCA, temporarily halts blood flow to the brain, which can lead to ischemic injury and delayed neurocognitive dysfunction. Although the brain is protected by hypothermia, prolonged periods of no circulation can lead to cognitive deficits postoperatively. Which of the following strategies is most effective in preventing pulmonary complications after CPB? A. Using low-dose steroids to reduce inflammation. B. Maintaining low tidal volumes during mechanical ventilation. C. Applying intermittent positive pressure ventilation, IPPV, throughout surgery. D. Using high doses of oxygen therapy postoperatively. Answer: B. Maintaining low tidal volumes during mechanical ventilation. Explanation: low tidal volume ventilation helps minimize ventilator-associated lung injury and inflammatory responses in the lungs, reducing the risk of acute respiratory distress syndrome, ARDS, and other pulmonary complications after CPB. What is the most significant cause of gastrointestinal dysfunction after cardiopulmonary bypass? A. Bile duct obstruction due to liver injury. B. Gastric ischemia from reduced splanchnic blood flow. C. Infection of the gastrointestinal tract from surgical contamination. D. Hyperperistalsis due to narcotic analgesia. Answer: B. Gastric ischemia from reduced splanchnic blood flow. Explanation: reduced splanchnic blood flow during CPB results in gastric ischemia, which can lead to gastrointestinal dysfunction, including ileus, gastric ulcers, or even bowel necrosis in severe cases. This is more common in patients with pre-existing cardiovascular or hepatic disease. Which of the following is a potential consequence of hypotension during the weaning phase of CPB? A. Improved myocardial oxygenation. B. Increased risk of myocardial infarction. C. Improved renal perfusion. D. Reduced risk of stroke. Answer: B. Increased risk of myocardial infarction. Explanation: hypotension during the weaning phase from CPB can lead to myocardial ischemia and infarction. This occurs due to insufficient perfusion pressure, which can exacerbate the effects of any underlying myocardial ischemia and compromise the heart's ability to recover from the surgery. What is the role of heparin-coated circuits in reducing organ damage during CPB? A. They reduce inflammation and platelet aggregation. B. They decrease the need for systemic anticoagulation. C. They improve oxygen delivery to tissues. D. They prevent microemboli formation during surgery. Answer: A. They reduce inflammation and platelet aggregation. Explanation: heparin-coated circuits reduce the activation of the coagulation cascade and platelet aggregation, which are major contributors to inflammation and organ damage during CPB. These coatings minimize the risk of thrombus formation and microemboli, protecting organs like the kidneys, brain, and heart. How does heparin contribute to organ protection during CPB? A. It prevents platelet aggregation and clot formation. B. It acts as an anti-inflammatory agent. C. It reduces tissue oxygen consumption. D. It stabilizes the blood-brain barrier during surgery. Answer: A. It prevents platelet aggregation and clot formation. Explanation: heparin is used during CPB to prevent platelet aggregation and clot formation, which can cause microemboli, thrombotic events, and organ injury. It helps maintain blood flow through the CPB circuit and reduces the risk of thrombosis and subsequent organ damage. Which of the following is the primary factor contributing to myocardial injury during CPB? A. Inadequate myocardial protection during surgery. B. High systemic vascular resistance during weaning from CPB. C. Excessive use of vasodilators during surgery. D. Hemodilution during CPB. Answer: A. Inadequate myocardial protection during surgery. Explanation: inadequate myocardial protection, such as insufficient cooling or insufficient cardioplegia during CPB, is the primary cause of myocardial injury. This can lead to ischemic damage, arrhythmias, and reduced contractility postoperatively.